Hi, I'm Michael Patterson from Eye Centers of Tennessee. Welcome to my YouTube channel. Thank you for coming today. You're going to learn through these videos surgical techniques and innovative technologies that you and your staff will be able to utilize to further patient care. Remember at the end of the video to subscribe down here at the bottom so that you can find further content in the future.
Hello, this is Michael Patterson. This is an interesting case of a traumatic cataract and a prior bleb. You can see here I was initially going to operate temporally, but I ended up going nasally because I couldn't get around the corneal scar as well as the iris that's plastered against the endothelium for about 3 clock hours, and so I was afraid the wound wouldn't close, and so I went nasally and operated over the nose, a little trypan blue and standard viscoelastic in to irrigate out the trypan blue. Capsulorhexis here, you see I'm just finishing up. I used Utrata forceps in this case just for good tear, and the interesting thing about this case, I decided to use the MiLoop device, and you can see here I wasn't sure about the zonule integrity, and I thought the MiLoop would give me the best option without any stress on the zonules whatsoever and as minimal phaco as possible, considering that the iris was touching the cornea for about 4 clock hours with the bleb. I thought the least amount of invasiveness, and you can see operating over the nose is not easy. I'm having a hard time just getting through, but the MiLoop swings through. I usually go a little bit further past midline, and then you gently cinch the cataract in half, and you can see there how it really does a good job. It kind of auto rotates it just a little bit, and you can deploy it back out, and then I'm cutting it again into more pieces, and you'll see that as I pull the MiLoop device out of the wound, no problem. Then when you go with phaco, you can already see the hemispheres that are cut in half and they're into the anterior chamber, and it just aspirates so nicely. You almost need no phaco energy. I can barely get my second instrument by the time I've already emulsified these pieces that are perfectly cut from the MiLoop device. You'll see here that I then just go into IA and remove the rest of the cortex, and we've got a nice capsulorhexis to then implant the lens in the bag, and without any trauma this patient ended up without any zonular loss at all, and the case went just fine. So he regained quite good vision. That's the end of the case. Thank you for watching.